Hi Year 9, I hope you're keeping well. Mrs. Green here with Lesson 5 of Ancient Medicine for you. Just a reminder, if you haven't yet completed the work for Lessons 1 to 4, please make sure you go back and watch the videos that have been created already for you, as they will help you complete the task for those lessons before continuing with today. So our title for today, as you can see here, is why was Roman public health so important to medicine? And hopefully by the end of our session, you should be able to explain why the Roman public health system was so effective. So far, our medicine course has been focusing on the Greeks, but as you will see from the text, the Romans actually conquered the Greek civilization in around 150 BC and added them to their empire. So if we take a look at our map, this is the Roman Empire in around 117 AD. You can actually see just how vast the empire was, and for Europe it was the largest that they had ever seen. Now, you should also note that it wasn't just confined to Europe, so even though we've got these green splodges and pink splodges and grey, this is kind of European territory. We've also got sort of parts of North Africa and parts of what we would consider part of the Middle East today. So the scale of the empire is really something for you to bear in mind as we go through the rest of the activities. Now, the Romans were very different from the Greeks, where the Greeks had been philosophers, they had been mathematicians. The Romans were more hands-on, they were practical, they were engineers, and they were architects. And they've had a lasting legacy in many of the countries that they had colonised. In Britain, for example, some of the most impressive aqueducts can be seen around the country today, and our road system harks back to the days of the Empire. But one of the most notable contributions from the Roman Empire was that of their public health system, and that's the focus for us in today's lesson. So we need to think about what actually constitutes a public health system. Okay, so public health here, as it says, is the health of the population as a whole, especially as promoted by the government. Okay, and this also includes our wonderful NHS service, who have been working so incredibly hard during the coronavirus and this pandemic. It means that we have access to hospitals, doctors, to vaccinations, to treatment, care for the elderly. It also means that food and drink that goes on sale to the public is of a good standard, is of a high quality, that we have access to clean drinking water. If you are consuming unclean drinking water, that's causing lots and lots of disease. So the fact that as part of our public health, we have clean drinking water is really, really fantastic and really helpful for us. And it also means that we have an effective sewer system. So even though the Romans didn't necessarily have anything as wonderful as the NHS, they were considered to be groundbreaking in terms of the scale of their public health system, and that's what we're going to think about today. So with that in mind, we're now going to move on to our first activity for today. So if you see here on the bottom half of our page, we've got a table that we need to complete. So you'll see here, it asks you to read the explanation and provide a main reason or factor for why the Romans built such a large public health system. Okay, so ultimately you need to reduce this information into a main reason or factor. Okay, so again, we need to bear in mind how big the empire was. And again, if you keep that in mind throughout, that will help you understand these different reasons, these different factors for the scale of the public health system. So we're going to go through an example. We're going to go through the first one. Okay, so here goes. Rome had a vast empire to defend and therefore needed a fit and healthy army to defend and run the empire. Some of the most impressive public health achievements have been found at the site of remote army bases. Many forts had baths and running water. Hospitals were also built at these camps and were well stocked with supplies and medical instruments. So one of the things I want to immediately highlight to you, okay, so we're going to take a highlighter, is vast empire to defend, a fit and healthy army. Okay, now these are really two really important points for us. Okay, so if we think about it, if we think about the scale of the Roman Empire, without a fit and healthy army, they simply wouldn't be able to survive. The empire would be at risk. if you've got an emperor who is in lead of the whole empire, they simply cannot be in the same place at the same time. They can't be everywhere. So they need people to help them control and to maintain the power of the empire. Okay. Now, if their men who are helping them control are not fit and healthy, they're not looking after each other, you potentially run the risk of your empire falling apart. And obviously, as an emperor, that's increasingly problematic. So public health has to be a priority. And clearly they made it such. If you see here, we've got forts which have got baths and running water. We've got hospitals being built. Okay, and then we've also got supplies and medical instruments. So that's really, really crucial if we're thinking about reducing this down into a factor. Okay, and for that reason, we're going to go with defence. Okay, we think about what this point is trying to make. Ultimately, fit and healthy army, hospitals at army bases, baths and running water, all simply comes down to having the ability to defend. Therefore, our first reason for the public health system being so large is for defence purposes, and you would simply write that in your first factor box. So, some advice then for when you're working through the 3 remaining boxes. Please make sure that you read through each explanation first, highlight those points just as I have done, because this will help you to create the factor based on what you have read. Okay then, so we're now going to move on to our second activity for today, and this activity works in 2 parts. So, firstly, you're being asked to read about the different aspects of the Roman public health system and then label the diagram using the correct terminology. Okay, and it's really, really crucial that you read through each of these information boxes first, because this will help you when it comes to labeling the diagram on the next page. So we're going to work through an example, and we're going to look firstly at bathhouses, so our second one here. So the Romans were famous for these, and if you were to travel to the city of Bath, which is in Somerset today, then you would be able to see the Roman baths there, so Roman baths that are still standing, and they've become a historic visitor site. So back to the bathhouses then. So we know that the Romans were very much concerned about health and cleanliness. Even though the Romans didn't have soap, they did have an oil which would be used to help clean them, and dirt would be scraped off the body using a stick-like instrument. So if we go through the key points here, okay, you'll be able to note that people didn't only just go to a bathhouse to wash. There were other reasons for going there. So they could exercise, they could socialise, and they could conduct business there. So we're going to just highlight that for you to bring that to your attention. Okay, so if we go to our diagram on our next page, I've inserted a text box here. Okay, obviously if you are on the paper version of the booklet, you can just write it on. If you're using it electronically, then just insert a text box like I have. Now this is where we are identifying a Roman bathhouse. Okay, so in there we would then write in bathhouse. Okay, so for the remainder of this task, again, you would go through, read through the rest of the boxes, and then add your label to the diagram on the next page. Please make sure that you also read the additional information box as well, because that will give you some key detail about disease and health at the time. So then, for the second part of this activity, as with all things in life, there are pros and there are cons. So your task is to go back to this text, okay, and highlight the problems of the Roman public health system. Because as I've said, nothing is perfect. There's always going to be some problems, some flaws, and therefore we need to identify, in order to be able to judge the effectiveness of the Roman public health system, we need to see what the problems are. So again, we're going to go through an example. We're going to go through a different example. We're going to be looking at the sewers. Okay, now we have a sewage system today in London. It's very effective, and ultimately it helps prevent disease from spreading. Now the sewers perhaps in Roman times maybe not as effective, and we're going to have a look and see why. So if we have a read through, so the sewers in Roman times were made of stone. They carried waste from the latrines, the houses and the baths. Now latrines are like a public toilet. If the sewers were too large, then the water could not flow fast enough to flush them. Likewise, if there was not enough rain, then the filth would build up and cause disease to spread. The sewers also emptied the waste into the river, which was used as a water supply and to clean clothes. Now, immediately, there are some definite problems that come up with the sewers. Okay, so really, really good that they carry away the waste from the latrines, from houses and from baths. That's really great. Now, here is where the problems lie. So if a sewer was too large, then the water could not flow fast enough to flush them, which means that you're simply going to have a build-up of human waste. Gross. Likewise, if there wasn't enough rain, again, the filth would build up. And unfortunately, this leads to a spread in disease. Okay, if we think historically about waterborne illnesses, things like cholera, okay, if you didn't have access to clean water, then it was quite easy to come across those kinds of diseases, and sewers were a very strong carrier of diseases as well at this time. Now, a third problem that I see with the sewers from this time is that they emptied into the river. Okay, so all the waste that it carried then went into the river. Now, this is a problem, okay, because this was used as a water supply, so perhaps for water, for cooking, for drinking, for cleaning, okay, and to clean your clothes. So ultimately, you are cleaning your clothes in water that has been filled with human waste. So some major problems here with the sewers. What you will see as you go through the information is that some of the factors don't have any problems, some do. Okay, so please make sure that you're reading through it very carefully, just to make sure that you're seeing whether there's a problem or not. And think about it from a human perspective. Think about it from the perspective of being a rich person in Roman times or a poor person in Roman times, which quite a lot of people would have been as well. Okay. Now, let's also remember that at this time, the Romans didn't have any knowledge about what caused disease. They simply were working on a basis of cleanliness and hygiene. And as you can see from the problems that are being highlighted by this task, they weren't perhaps as clean as we thought they were. They also wouldn't have realised that emptying the sewers into the river would be such a problem. So, you should have, by the end of this lesson, all your labels added to your diagram. You should have key bits highlighting the problems, okay? You might want to add some points in there about why this was a problem. So if it's not overtly obvious, okay, so we've got one here. In some places like Lincoln, the water was only changed once a week. You need to consider why that might have been a problem and how that maybe damaged the effectiveness of Roman public health systems. Okay, so let's go back to our lesson objective, so explaining why the Roman public health system was so effective. And this is what we need to think about for our lesson summary for today. Now, I realise that in your booklet that there isn't necessarily a designated spot on the page, so it might be that in a space on this page that you write 3 bullet points to summarise our lesson for today. Okay, so we need to think about the effectiveness of the Roman public health system. We need to also take into consideration the problems that you would be identifying from this task, because that will obviously impact overall on the effectiveness. So perhaps one point that we could identify is about the benefits of the Roman public health system. Okay, if we go to here, we're looking at the streets. Okay, it says in here that the streets were emptied every single night, which helped prevent the spread of disease. So there are benefits to the public health system. So that might be one summary point that you put into your summary box. When you're coming up with your 2 other summary points, you might want to make a point about the scale of the public health system, so the size of it, why it was so big, and why it needed to be so big. So if we're thinking back to task 1, things like aspects about defence and power, then you can put a point about that. You also additionally might want to put in a point about a problem or some of the problems, so how the effectiveness was limited because of such problems. Okay, lovely. So that's it for today, Year 9. As always, if you have any questions at all, any concerns, please make sure that you email your history teacher. There will also be a new video sent out for your next lesson, so please keep an eye out for that next week. And hopefully we will see you soon. Take care, guys.